There you go.
Sanjay, and I live in Leawood, Kansas.
And tell me about your role with St. Luke's.
I'm a cardiac electrophysiologist, so I deal with the heart rhythm disorders, and so I see patients in clinic, and we do procedures to either implant devices or do ablations, which are procedures where we take catheters into the heart and we destroy small pieces of tissue that are causing abnormal heart rhythms.
Okay. And you are also our Heart Walk
I am,
co-chair,
indeed,
correct?
yeah.
All right. Do you have a personal experience with heart disease?
Sure. Probably the most personal one that comes to mind was about 6 years ago. My daughter was celebrating her 5th birthday, and we had a family get together, and my in-laws came to visit, and my father-in-law woke up one morning and was profoundly dizzy, could not even stand, and something was very significantly wrong with him. He called us, we went over to the hotel where he was, and we knew immediately that something was not right. We called an ambulance and brought him into hospital. At that point, I was at the University of Michigan, so we brought him in there, and very quickly determined that he was having a stroke. And that was quite a surprise to all of us. Obviously, he's a very healthy man and otherwise really had no other problem. And when I was with the emergency room, they hooked him up to the monitor, and I immediately knew And so one of the things we realized is that he was having atrial fibrillation, which was at that point was something I treat every day, and it was something that I was very used to seeing in my patients, but it was to see it in a family member and the effect that obviously was having on him. It made it very personal for me, and obviously it really hit home what we deal with every day. And so when and he did great, and he really recovered completely from the stroke, and that was great. And as I advised him on treating him for his atrial fibrillation, he did really very well, and he really looked at himself and made a lot of lifestyle changes. He lost weight, he got treatment for sleep apnea, he got his blood pressure under control, he exercised, he did everything we asked him. I still tell him to this day that he was our best patient, and he's done so well, and now years later he's actually come off all his medicines. He's been doing really, really well, and it's been a real success story. And I use him now as a model for teaching my patients, and for me, he's inspirational for me because he really he really was took this on and really looked at himself and made those changes, and has been a survivor because of it. So so that's something that has really made it very personal for me, and made it very helpful for me to when I tell patients and teach patients, I can say, I get it because it's touched my family too.
That's great. That was actually going to be my next question was, how have you, maybe changed, your perception or how you treat patients, being a part of the family and seeing it from that side.
Yeah. And I think it has made me able to empathize with people more, just knowing the impact that this has, and for people saying that, I don't want to take these medications. I don't like the way they make me feel, and these are the issues. And I can understand because we've been there, we've had those discussions, and I know how it affected him personally. And we have options, and these are the things that that makes me able to counsel them more just on a personal level, which is very helpful, and I really can relate to them better.
Sure. You've been a great advocate for the American Heart Association. Why is the American Heart Association important to you?
It really is behind everything we do. So in that story that I told, it's everywhere. So in the protocols that everybody follows to stop, so that you get treated with stroke efficiently in an effective manner, all that is developed by the American Heart Association. We all were taught on that, and the research that has led to the treatments and the cures that we have today, all that is funded by the American Heart Association. And the guidelines we have and the education, the public service that we use to treat people, to present and to get treated earlier, all that is from the American Heart Association. It touches everything that we do.
Anything else that you want to share that I haven't asked?
We would like to encourage people to join Heart Walk. It's a great event. It is something that we are really excited about. It is fun. It's something that is great for the whole family. You can bring your kids, you can bring your dog. You can come and you can be with your coworkers, and it is just a great empowering feeling to be with 10,000 or hopefully more Kansas Cityans who are out there, voicing their support and raising awareness for heart disease. So please come.